Today at lunchtime. I am worried about the mixed messages on the environment. I'm very worried about the lack of measures to tackle in a genuinely energetic way inequality. And I do hope that when the comprehensive spending review comes up, we will look really at the role of local government and the way it can really take on the climate challenge. Thank you very much, Mr. Deputy Speaker.
This evening to the final speaker, Stephen Crabb.
Thank you, Mr. Deputy Speaker. It's a privilege to conclude the first day of the debate on the budget, and it's a pleasure to follow the Honourable Member for Hornsey and Wood Green, who always makes very thoughtful speeches. I'd like to start, Mr. Deputy Speaker, by putting on record my own congratulations to my right honourable friend, the Chancellor, who presented today a very strong, future-facing budget. And before I say more about that, I'd like also to put on record a tribute to my very good right honourable friend, the member for Bromsgrove, who was his predecessor, and who might not have been long in his tenure as Chancellor of the Exchequer, but I believe that he was part of that change of mindset at the Treasury, which the Chancellor spoke about today. The right honourable member for Bromsgrove said that he recognised much of what was in the budget statement. Well, he might, because, as I said, he has contributed to some of the new thinking. Indeed, it was back in 2016, summer of 2016, when he and I together presented a plan for a Growing Britain Fund, a £100 billion fund for investing in long-term productive infrastructure for this country, precisely taking advantage of record low borrowing rates at the time. So it is very encouraging, Mr. Deputy Speaker, to see some of those ideas come to fruition today in the budget statement that we heard earlier this afternoon. If the budget was about looking to the future, it was also, Mr. Deputy Speaker, about facing up to the very real challenges of the present. It was a budget delivered in the shadow of the growing coronavirus crisis. All governments around the world are trying to wrestle with this problem. All governments are trying to work out the science, work out what the correct balance and trade-offs are between measures and tactics to contain and delay the virus and not imposing excessive economic cost on their citizens. And every government is working out these decisions for themselves, but the challenge is very considerable. And what we saw today, Mr. Deputy Speaker, in response to that growing crisis is something that we should all be encouraged about. We saw the United Kingdom able to take a strong set of measures, communicate those internationally, to international markets, to domestic markets as well, a strong set of coordinated messages from different branches of government, starting with the Bank of England this morning, followed up by the Chancellor of the Exchequer in his budget this afternoon. And the platform for that strong, coordinated response to the coronavirus has come from two things, I believe, Mr. Deputy Speaker. Firstly, a broadly sound set of public finances after 10 years of responsible decision-making by successive Conservative administrations, and also a banking system that is far safer than what it was in the previous crisis of 2008. And together, this action, I believe, has created a strong framework for protecting our economy, our businesses and our citizens from whatever the coronavirus may throw at us. So, like many other members who have spoken this afternoon, Mr. Deputy Speaker, I too strongly welcome the very balanced, very sophisticated packages of measures to support business at this time of crisis. My own constituency, as you know very well, is a coastal, beautiful, peripheral constituency with a great many businesses in tourism, hospitality, leisure that are looking forward to the start of the new season in just 3 weeks' time. Like many members, I've spoken to a lot of these businesses in recent days who've expressed to me a growing sense of concern and fear about their business prospects this year. Many of these are businesses that will lose money during the winter months and earn their money during the strong summer season. And what they're already reporting to me, Mr. Speaker, is bookings down, and where bookings have previously made, they're only secured by 30% deposits. And the danger is, the fear is that this is going to prove to be a very, very challenging few months indeed. One idea that was put to me by one of the businesses I spoke to was that the government should delay implementing the increase in the national minimum wage. My own view of that, which I communicated strongly to this business, was that would be the wrong thing to do. We're a government that is proud of our track record of increasing the national minimum wage, putting more money back into the pockets of those on the lowest incomes. But it's a measure and a sign, a signal of just how fearful I think many small businesses are about their cash flow prospects in the weeks and the months ahead. And I believe the measures set out both by the Bank of England and by the Chancellor today provide a measure of resilience for many of our small businesses. I also strongly welcome the measures around protecting family income, the measures around statutory sick pay, Mr. Speaker. If I have a couple of concerns that I want to put on record, one of them would be, firstly, we're placing an awful lot of faith in the banks to do a lot of the heavy lifting of providing support to small and medium-sized businesses. And those colleagues who've been around in this place for the last 10 years, most of us will have seen cases in our own constituencies of small businesses not being treated well by the banks, being treated unfairly, at times being thrown under the bus. So we are looking to the banking sector, especially in light of the measures that the Bank of England were able to take to help bank balance sheets this morning. We are looking to the banking sector to really make good on delivering the support to small businesses at this time. My second area of concern, Mr. Speaker, that I'll put on record is my concern around the position of the self-employed when it comes to weathering the storm that coronavirus potentially places on them. I think this crisis, as a number of members have already commented on this afternoon, this crisis, I think, will highlight some of the vulnerabilities and just how fragile some of the people working in our economy actually are. We are a government that's very proud of our labour market record. The United Kingdom's record in creating and sustaining jobs over the last 10 years is nothing short of remarkable. One of the keys to that has been around flexibility, but we should not make a god of flexibility. And I think one of the areas that we will need to look at in the weeks ahead is how we ensure that people who are working as self-employed, people who are freelancers, people who are working in the gig economy can get better social protection at a moment of crisis. So I'll wrap up there, Mr. Speaker, but simply say that I thought my right honourable friend, the Chancellor, did a superb job. It is delivering a very good, strong first budget this afternoon.
Order. Debate to resume what day? Tomorrow. Before I call the Secretary of State to make his statement, I would like to draw the attention of the House to the fact that this statement on coronavirus is streamlined with the accompanying British Sign Language interpretation at Parliament Live TV. Secretary of State for Health.
Mr. Speaker, this afternoon the World Health Organization declared coronavirus a global pandemic. I've spoken to the Leader of the House and we have had discussions, Mr. Speaker, and we have resolved that we will keep Parliament open. Of course, in some ways, this House may have to function differently, but the ability to hold the government to account and to legislate are as vital in a time of emergency as in normal times. Our democracy is the foundation of our way of life. Turning to the advice that's being provided to Parliament, may I start by welcoming, Mr. Speaker, the way in which you are working with government. I know how seriously you take the well-being of all members and staff in Parliament, and the government will continue to work closely with you, the Lord Speaker, and the authorities in both houses in the coming days and weeks. As the Leader of the House said in Business Questions last week, the public will expect Parliament to sit and to get on with its job. Our approach will be guided by the best scientific evidence and medical advice, and we will take all necessary measures to deal with this outbreak. Mr. Speaker, I know that you are committed to providing as much information to members and staff as possible and to take any action that's required. A cross-parliamentary group of senior managers meets daily to plan the response to COVID-19 and to ensure business continuity with close input from the government. It is essential that the parliamentary authorities continue this work closely with the government and in line with medical advice, and I commit us to that endeavour. Both houses are conscious of our national role at this time, and by basing decisions on the very best public health advice, we can be confident we're doing the best we can to respond to this virus. Mr. Speaker, around the world, the number infected is rising. As of today, here at home, 456 people have tested positive, and 8 people are now sadly confirmed to have died. The positive cases, of course, include my honourable friend, the member for Mid-Bedfordshire. She has done exactly the right thing in following the official advice to self-isolate, and I know that the whole House will wish her well as she recovers. Yeah. Public Health England have world-class expertise in contact tracing, which they initiated as soon as her case was confirmed. They will contact anyone they think may need testing. This will only include those who had close contact. The advice of the Chief Medical Officer is that close contact is defined by being within 2 metres of someone who has active symptoms for more than 15 minutes. Those who have not been in close contact with my honourable friend since Thursday have no cause for concern in this case, and anyone who has concerns should seek guidance from Public Health England. And I also know, Mr. Speaker, that my honourable friend wants me to pass on her thanks to officials at Public Health England and to the NHS who have been brilliant throughout. Mr. Speaker, of course, a member of this House and a health minister testing positive has brought this issue home to us all, and I know that the public will be concerned that it's now been deemed a global pandemic. The official advice is clear. People should go to NHS 111 online or call NHS 111 if you think you have symptoms of coronavirus, notably a cough and fever. And of course, the best way to minimise the risk to yourself and others is regularly to wash your hands. Mr. Speaker, earlier today I chaired a meeting of COBRA. Our response will be built on the bedrock of the science. It's clear that we will need legislation to ensure the best possible response. I can tell the House that I've invited the official opposition to meet with me first thing tomorrow to discuss the proposed emergency bill that we'll set out before the House next week. In addition to the measures my right honourable friend the Chancellor set out in the budget earlier, the bill will include measures to help in the national effort to keep vital public services running, to support businesses, and to help everyone to play their part. Adult social care will be at the front line of our response, with social care providers looking after many of the most vulnerable in society. We're working closely with the sector to make sure it is ready. Tomorrow, the Prime Minister will chair a further meeting of COBRA to decide what further measures may be necessary. We will do the right thing at the right time. I know how worrying this is. I know people have deep concerns. I know everyone will play their part in this national effort to defeat the virus. The best way to beat it is for us to work together. And Mr. Speaker, we will do whatever it takes. We will give the NHS whatever it needs, and we will do all that we can to keep people safe and get through this together as a Parliament and as a nation. And I commend this statement to the House.
Shadow Secretary of State Jonathan Ashworth.
Thank you very much, Mr. Speaker. Can I thank the Secretary of State for advance sight of his statement? Can I thank him for making arrangements to come to the House at this relatively late hour in unusual circumstances, but entirely appropriate given the circumstances? And can I thank you, Mr. Speaker, for your constructive engagement with these matters with the opposition? And I know you will continue to engage with us on these matters as well, and we welcome that. Can I put on record my sorrow that 2 more people have died, and express our deepest condolences to the loved ones and the family of those who have sadly died. And again, we thank the NHS staff and Public Health England staff for all that they are doing. Can he convey our very best wishes to the Parliamentary Under Secretary of State, who is in all our thoughts? And can he also convey our best wishes to her staff, both her staff in her departmental private office and in her parliamentary office, all of whom I'm sure will be very worried, and I want them to know that they are in our thoughts as well at this time. We welcome what the Secretary of State has said around Parliament and the advice he has given us about keeping Parliament open. It is crucial that members can continue to raise issues on behalf of their constituents, and it's crucial that members can continue to hold ministers to account. I note what he says about procedures or arrangements may need to be modified, and we look forward to continued engagement on that front, but we welcome the advice he has given us today. I welcome the advice he has given to us around people who have come into contact with the honourable member, but could he offer us some extra advice? Because I've heard cases of this today. What is the advice for those who work on the estate, who feel ill, who appear to have symptoms, but have not, as far as they are aware, been in contact with the honourable lady? Should they now be tested as well as a matter of routine? The advice for them is just to self-isolate. Could he just offer us what the latest guidance is on that front? We welcome the opportunity to discuss emergency legislation, and I can tell him we will engage constructively on that front. He knows we have concerns about statutory sick pay and in other areas, but we will engage constructively on that front, and we'll look to pass emergency legislation in a timely manner. He also knows that we are supportive of the action of the Chief Medical Officer, and we strongly agree that we must at all times be guided by the science. But can I, if I may, just press him a little further on the epidemiology and the latest medical advice, and about the appropriate moment in which we should move into the so-called delay stage and start adopting some of the more stringent social distancing strategies. He will have seen that there are those in the science community, the editor-in-chief of The Lancet, for example, suggesting that we are not following the epidemiology in the correct way, suggesting that we are perhaps placing too much emphasis on behavioural science. There are other countries taking different approaches. Tonight, for example, 3,000 Atletico Madrid fans are arriving in Liverpool to watch the Champions League game. If the game was in Madrid, they wouldn't be able to go to the stadium to watch it because of the Spanish social distancing measures. So can he just explain, for the benefit of our constituents, what the thinking is in the United Kingdom and why it appears to differ from some of the other nations in Europe? I just think our constituents would find that explanation, would welcome that explanation. Just a couple of final points, Mr. Speaker. Just on the budget, it would be churlish of me not to recognise that extra funding was announced for the NHS and social care as part of the COVID-19 response. It's something we've long been calling for. Can he tell us how that money will be allocated and what happens when that money is depleted? The NHS today has said it is seeking to scale up intensive care beds 7-fold. That fund will run out at some point. It will need topping up. Do we have to wait for the spending review process in the summer, or will it be topped up over the coming weeks and months? I'm sorry to ask him again, when are we going to get the public health allocations? I would have thought we'd have had it today. Please let us know when we're getting the public health allocations. We need to do all we can to support NHS staff at this time. The NHS Confed has suggested suspending CQC inspections for now. What is his view on that? And as he says, this is now designated as a pandemic by the World Health Organization. We agree with him. We all have to do our bit. The government has our continued cooperation because public health and public safety must always come first.
Well, thank you very much, Mr. Speaker, and I'm grateful to the Shadow Secretary of State for the tone that he has adopted and the fulsome support for keeping Parliament open. And if I may, he raised statutory sick pay. Statutory sick pay and the measures that we're taking in the bill are an example of why accountability helps get the response right, especially when there's a constructive tone as there is, because he was the first person to raise the issue of statutory sick pay across these dispatch boxes, and it will now be in the bill. And because the point that he raised was the correct one, and we therefore took action. Likewise, the bill has been drafted alongside and with contents put in it from the Welsh Government, the Labour Welsh Government, the SNP Scottish Government, and the multi-party administration in Northern Ireland. It is a true cross-party effort. He asked about advice for those who are ill but can't recall whether they came into close contact with the Honourable Member for Mid-Bedfordshire. The answer for that is to call 111 and to ask the questions and then get the clinical advice and follow that advice. And the advice may be different for people in different circumstances. And so when people see others having been recommended by 111 to follow certain advice, they should follow that advice because it takes into account a clinical judgment based on the information that's provided to that clinician. We will, of course, as I've repeated many times, be guided by the science. He asks about, some voices asking whether the appropriate moment for further action is now. Of course, we keep action under review all of the time. And as I said, the Prime Minister is chairing a COBRA tomorrow. There are some voices that are saying that we should not base our response entirely on the science. And I think that those voices are wrong. And he asked about differences with other countries. He mentioned Spain, but there's others. The truth is, different countries are in different stages of this. The point is that we will do the right thing at the right time. And there are some countries that aren't fully following the science, but I'm not going to criticize them because I think in responding to a pandemic like this, everybody is doing their level best. He asked about money. There was a very significant increase in funding, £6 billion for the health, NHS and social care system. It's very important. This is for social care too. We want to make sure that the social care system has everything that it needs to respond to this crisis, because we entirely understand both the strains on the social care system should a large proportion of the population fall ill, but also the importance of the social care system, because that's where so many vulnerable people either reside if they're in a care home or are supported. He asked if we have to wait for the spending review for any top-up. The Chancellor made quite clear in the budget that we will not. He asked about the CQC. The CQC have already published a statement today saying that they are relaxing some of their requirements and taking into consideration the impact of coronavirus. And I welcome that. They are, of course, independent. And he asked about the public health grant budgets. And as I made clear yesterday, those budgets are going up in real terms in every single local authority area. And the precise details will be set out very, very shortly.
Jeremy Hunt.
I would like to thank both front benches for the highly responsible way that they are approaching this crisis, which I think does show Parliament at its best. And I want to thank the Health Secretary for his role in getting those very generous words for the NHS in the Chancellor's speech this afternoon, which have been widely welcomed across the NHS and much needed. The Chief Medical Officer says that you have to be pretty optimistic to think you could contain the virus in this country. The Deputy Chief Medical Officer says she thinks that we may hit the peak in the next fortnight. We now have more reported cases in this country than there were in Wuhan province when they went into lockdown. We know that he will rightly follow the science, but could I ask him to give his judgment to the House as to whether he thinks we still can contain the virus in this country? And if not, whether he expects to move to the delay phase very soon so that families up and down the country can start to prepare their loved ones for any precautions they might want to take.
Well, I want to make two comments in response to that. The first is that I just want to slightly correct the point about the Deputy Chief Medical Officer, who said that in the next couple of weeks we may see the numbers starting to rise fast to their peak. We do not expect numbers to peak in the next fortnight. We expect numbers to continue to rise after that. And the peak would be in a matter of a couple of months rather than a matter of a couple of weeks. This is a marathon and not a sprint. On the second point that he raises, of course, the World Health Organization this afternoon declaring that this is globally now regarded as a pandemic does indicate that they think that this virus will spread right across the world. And that has a significant impact on the way that countries around the world will now take forward their plans. Of course, this is all within the plan that we set out, an expectation that this may well happen, and we'll be discussing that at COBRA tomorrow.
Dr. Philippa Witt.
Thank you very much, Mr. Speaker. I would echo our good wishes to the member for Mid-Bedfordshire. I welcome the declaration to keep Parliament open, but surely we should be looking at core functions. We should be looking at who comes into the House, what we do in the House. And I have to say I was a bit disappointed to have several hundred of us jammed into voting lobbies on Tuesday. This is just not a good idea. So there are ways of how we work that would still allow Parliament to stay open. With cases having increased by 13 times outside China in just 2 weeks, it has, of course, been declared by the WHO as a pandemic. But they do describe being concerned at levels of inaction. They call for quicker and wider testing so that milder cases are diagnosed quickly, isolated, and the spread reduced. Obviously, we've seen the speed of change in northern Italy over a matter of a couple of weeks. So should we not be thinking about the delay phase? Containment and delay are a continuum. It's not a switch between one and the other. And to see leisure events, large leisure events, still continuing, they are not critical. So should we be decreasing those? Do we know yet whether children are spreaders? We know they don't catch it, but do they spread it? Because that would be central to any decision about closing schools. And obviously closing schools would have an impact on NHS and social care staff. I welcome the announcement in the budget about funding to support people on sick pay, but I wonder if the Secretary of State could clarify whether this will be provided to people who do not have sick pay in their contract, because that's exactly who we were concerned about when we raised this. How quickly will all three devolved governments hear about the extra funding they're going to get, because it's urgent for them to take action as well? There has been talk about bringing doctors back from retirement. So is there discussion with the General Medical Council about relicensing doctors? Is there discussion about providing Crown indemnity for doctors who have maybe retired within the last year or 2 years? The UK is now already outside the European Centre for Disease Control. So will the government now at least rethink leaving the pandemic early warning and response system?
Thank you very much. The Honourable Lady asked some important questions about how Parliament will function. Matters for how we work are, of course, for Parliament, for the Leader of the House, the Speaker, the Commission, all guided by the science, and they are in constant contact with Public Health England to get the very best advice. Of course, when we're voting, if we are not symptomatic, if we don't have symptoms, then this disease passes in the very, very large part from people who have symptoms. So what really matters is making sure that as soon as people have symptoms, potentially of coronavirus, they get in contact with 111 with Public Health England. She asked for more testing. We are absolutely ramping up the testing capabilities. And have been commended for the approach that we're taking by international bodies. She mentioned the WHO. She asked about children. The good news, one of the good pieces of news about this virus is it does appear to have a much, much less significant impact on children. She asked about the GMC and indemnity. Absolutely, both of those issues will be addressed in the bill. And we're working very closely with the GMC. She also asked about collaboration and work with the European Union. We still remain in the European Union data transfer capabilities, although most of this data is being transferred, frankly, is being published. We're being as transparent as possible. This week we brought out a new website to be transparent as possible about all the cases in the UK, and most European nations are taking exactly that approach.
Can I just say to help members, I expect to run this from an hour from now, and that should accommodate everybody. Steve Bryan.
Thank you, Mr. Speaker. And just taking the Secretary of State back to his point about a real national effort and to the point that he raised last week about the supermarkets helping get supplies to elderly and vulnerable constituents, many of whom can't get out, and right now we don't want them to. I just wonder whether he would join me in paying tribute to the army of volunteers across this country in community shops such as the Hursley Community Shop in my constituency, which told me today of the service that they're running for elderly parishioners in getting essential supplies to them, picking up prescriptions for them. It's a brilliant example of the big society, remember that, doing its bit to help this country get over this terrible time.
Gosh, that's a blast from the past. That phrase was invented about almost exactly 10 years ago, and he's quite right, though, that this is a national effort, and community shops can play a huge role in helping people to get the supplies that they need, the groceries and other supplies. There's been much discussion of supermarkets, and I'm glad to say that the vast majority of supermarkets are playing an absolutely incredible part in this national effort, and we're working very closely with them and have been for some time. But our community shops will be right embedded in those communities and often know who are the people who are going to need the most support and have those personal relationships. And so long as they're following the public health advice to ensure that the people they're helping are also kept healthy, then I think that they have an important role to play in our national effort.
Thank you, Mr. Speaker. Can I just press the right honourable gentleman on the issue of the Atletico Madrid fans who are in Liverpool at the moment in a crowd of 54,000 at Anfield? There's about 3,000 of them who've travelled. Schools and colleges are closed in Madrid and public gatherings of over 1,000 people banned because there's a cluster of 782 coronavirus cases and there have been 35 deaths. Now that we've got a pandemic, is it really sensible for that to be allowed to continue? But both the government and UEFA have told the Liverpool Echo today that it's not up to them to take action. So who is it up to? And is it really sensible for fans who couldn't watch their team at home to be able to travel to Liverpool and watch their team play with 51,000 locals? Is that really sensible?
Well, of course, it's for public health, England, to make advice available and to give guidance, and we will always follow the scientific advice on what makes the biggest impact. But the interesting thing, if you listen to the scientists, is that sometimes the things that may feel intuitive to us as lay people, that we think they have the biggest impact, don't in fact have the biggest impact. The measures that we are taking and proposing to take, for instance, looking at asking for people who have symptoms, however mild, to stay at home, we are aiming at the things that have the biggest impact. And there are some things that feel right, but don't have an impact at all. And that's why it's so important to follow the science and what Public Health England say.
Dr. Luke Evans.
Thank you, Mr. Speaker. Primary care clinicians are expected to collect QOF data. This can be time-consuming and take them away from their clinical work. Will he consider suspending QOF data?
We are looking to reduce bureaucratic burdens on primary care and on GPs. We were looking at that anyway, but we've accelerated that work because of this outbreak. And, of course, we've moved to a principle of digital first in primary care as well as with outpatients. If you can, unless you have clinical reasons not to or practical reasons not to, then all consultations should be done by telemedicine.
Dan Jarvis.
Thank you, Mr. Speaker. I'm grateful to the Secretary of State for his statement and for all the work that's going in to keeping the public safe. In conversations with colleagues in South Yorkshire today, there's been a specific concern raised about the guidance for GPs for personal protective equipment. There have been some issues relating to the resilience of the social care sector. But can I just again very gently push him on the issue of the public health grant allocation? I very much welcome the fact that the Secretary of State has said that there is going to be an increase, but I'm sure he will acknowledge that it's in everybody's interest for our directors of public health to have the knowledge of precisely what their budgets will be sooner rather than later.
Yes.
Thank you, Mr. Speaker. That was very quick. I'd like to associate myself with the remarks made by the Secretary of State, and I do wish our colleague the very best and that her family also recover as quickly as possible if they succumb to the virus. My constituents in mid-Derbyshire have developed a test to test for the virus. They are selling it all around the world, but in this country, we are not using it. It costs £5 to test it. It is working, and it gives a definition within 10 minutes of the test. So it's a quick, cheap way to do it. Please can I urge the Secretary of State to ask the department to investigate it and to make sure that we're using the most effective test that we possibly can?
Yes, absolutely. My honourable friend has brought this to my attention before. We have done research into it, and we're working with over 24 commercial companies who have tests of this kind. And in fact, I had a meeting on this today.
Manira Wilson.
Mr. Speaker, I welcome the Secretary of State's focus now on social care. Could he clarify how much of the additional spending in today's budget will be going into social care? Will PHE be issuing protective equipment to care workers? And also, his statement refers to adult social care. There are many sick children in this country who are reliant on care, and will he be ensuring that children's needs are not overlooked? I did write to him about this matter earlier this week, so I'd welcome clarification.
As she knows, there's guidance coming out this week. She's right about the importance of protective equipment, and of course we're taking that into account. In terms of money, the Chancellor did set out that there will be more money available if it's needed in social care, and I expect that it will be. And he set out a total of up to £5 billion for the NHS and social care, but saying his door was open should more be needed. These are all very important considerations, and the guidance will be out